Hi, Karen. Hi, Jasmine. Welcome you
Hi,
both
Monica.
today for our conversation. May is Women's Health Awareness Month, so I thought we could get together and just talk about our experiences, living with sleep apnea. I mentioned this before, and a lot of our audience members will know I was diagnosed with sleep apnea about 10 years ago, and part of my reason to move into advocacy in this space is because of my own personal experiences. But today I wanted to give a chance to you both to share your own personal experiences living with sleep apnea and how that has impacted your life and how that has made you want to come forward and share your stories and your experiences. I'm not going to get into your bios today because we do have both your bios on our website. If people want to look up Jasmine's bio and Karen's bio, they actually both are members of our Community Leadership Council. You'll find that under our advisors, about us, advisors tab under Community Leadership Council members. Jasmine's story is also on our website under apnea stories. So you have more information there about Jasmine. All right, so let's get into this. Karen, let's start with you. You're already an influencer. A lot of people in the sleep apnea field know you, and I have had the pleasure to actually spend a few days with you at the American Thoracic Society meeting. But let's start off with your experience with how you got diagnosed with sleep apnea and what your journey has been like.
Thank you for having me on, and really excited about raising awareness for women's health issues. Sleep apnea, it's something I didn't even know what it was before I found out that I had it, and it took 45 years to get diagnosed. Turns out I have the airway anatomy that makes it pretty much a guarantee that I had it since I was born. So I've kind of always been this way, but I didn't know until I accidentally saw a sleep doctor. The sleep doctor wanted, I was having a family member come and see the sleep doctor. So I was just coming along to support. And because I'm such a direct relative of this family member, when the sleep doctor wanted to see them for another sleep issue, they looked at their airway anatomy and immediately wanted to look at mine to see if that's where it came from. And wouldn't you know, they were correct. So before that, and that was around 2015. Before that, in around November 2011, I started to seek out treatment for word finding problems. I was having trouble. I was doing large trainings for a electronics company at a electronics retailer, and remember was doing a training on a digital camera, and I could not. It was a digital SLR, and I couldn't remember the words lens cap. And I remember looking at the lens cap and not being able to identify what it was. And there was a lot of other issues like daytime sleepiness and problems with just staying awake, yawning a lot. I just didn't know what was wrong with me, but I thought I'm having problems with focus and memory, concentration. Putting together things that used to be easy for me were getting more difficult. So I went to see a psychiatrist. I figured that maybe it was in some type of attention issue and maybe they could help me. So I did go see a psychiatrist, and I tried a medication for attention called Strattera. And, it did do a few things for me, but it didn't really fix my problem. So that psychiatrist sent me around to a bunch of other specialists for the next few years. And I was at a neurologist, an endocrinologist, a rheumatologist, went all over the place to try and find something, and kind of ran into nothing. But then I was in the middle of, with a rheumatologist, looking into fibromyalgia as something that might be going on. And then when I got diagnosed with the obstructive sleep apnea in 2015, that diagnosis immediately went away. And they said, oh, well, if you have sleep apnea, then that kind of answers what's going on. So you should probably pursue the treatment there. So that was late 2015 and completely by accident. And I do remember the day that I went in for my consult, I remember the first thing I saw was another patient leaving the office pretty angry. And I remember them being told that they were non-compliant. Those words were exactly what I heard. And
Mm-hmm.
I remember being puzzled about why they were so upset and why they left the office so abruptly. And I asked the question, what do you mean they're non-compliant? They said, well, they're non-compliant with their CPAP, so it's been taken away. And I was pretty horrified to think that the thing that I was there to find out if I, have, um,
Right.
that the treatment that I could get might get taken away, which is very odd to me. I'd never heard of that before. And also, like I said, I didn't even know what sleep apnea was until I found out I had it. So that was kind of my, I guess, happy accident of diagnosis, where another family member was how I ended up there, even though I had been seeking an answer to my problems and my symptoms that have been ongoing. Also, I would say some anxiety symptoms, some
Mm-hmm.
panic attacks, and let's say pretty bad depression that it
Mm-hmm.
was setting in, and I didn't quite know. That's also why I had gone to the psychiatrist, was like, what is going on? Why am I so anxious all the time? What am I feeling? Why am I feeling it? Where is this coming from? There didn't seem to be any reason to feel the way I did. I was anxious about stuff that didn't seem like actually an
Yeah.
issue when I look back at it. So that was my story on that.
Wow. That's amazing. And we'll get back into the treatment aspect. That's pretty scary too, walking into a doctor's office and then hearing those words, hoping to
Yeah.
get this treatment. Jasmine, could you want to share your sort of journey through all of this with your diagnosis of sleep apnea?
My diagnosis was pretty accidental, like Karen's. I just one day was standing in the kitchen and had no idea how I got there. I had no idea what I was doing. I was in the cabinet reaching for or putting away, I'm not even sure, a cup. And I was standing there staring at the cups. And I finally, my brain started to work and I was like, what just happened?
Mm.
I have no idea how I got here. I have no idea what I'm doing. This is terrifying. And from then I went into panic mode, and I was just going, what could possibly cause this? What could possibly be, driving my brain to glitch out the way my family's gotten used to calling them
Mm-hmm.
glitches now.
Yeah.
Mom, you're glitching again. And I'm like, okay, I guess I better go sleep, you know.
Yeah.
But from then I just started diving into specialist after specialist, trying to figure out what is going on. I went into Alzheimer's clinics. I tried to get a hold of the Mayo Clinic. I went to the VA. I was like, look, there's something seriously going on here. And they did test after test after test, and everything came back normal. And finally, I was like, I don't even know what to do anymore. So I branched out into the holistic field, and I started doing
Mm-hmm.
acupuncture, and I started doing meditation, and I started doing anything you could possibly imagine to try and figure out what was going on. And then finally, I was like, well, maybe the only thing I haven't tested is my endocrine system. So I went into an endocrinologist, and all of those tests came back normal. And so then I was standing there just panicking, going, there's got to be some answer. Somebody's got to know what is going on with me. And the endocrinologist came into the office to go over the results with me. And he said, did you mention something about sleep apnea? And I said, yeah, the VA flagged me for sleep
Mm-hmm.
apnea 7 years ago. And I have sleep apnea, but I have severe claustrophobia. And the VA only offers the CPAP. I can't wear it. I tried.
Mm-hmm.
And he goes, well, honey, that's your problem right there. He goes, sleep apnea will affect every single cell in your body. And every single symptom that you're having is the direct result of sleep apnea. And I said, what? You've got to be kidding me. There's no way that just some lack of sleep is going to cause everything that has gone wrong with me. Because I'm telling you, I could sit here all day and go over all the lists of things that was wrong with my body, all the way down to my hair and my fingernails. Just like my hair was falling out, my fingernails were
Mm-hmm.
just breaking, and like they were just jello. I couldn't figure out what was going on. But I mean, the organs in my body, I developed scoliosis in my spine. I'd had spinal fusions. I lost my gallbladder. I developed thyroid issues when I was 18 years old. My eyes were going bad. My ears were going bad. I mean, you name it, everything. I had severe, what was it? I can't even think of the word. I'm glitching. Anyhow, you get the point. But then I started to really dive into the research behind it and to try and figure out, you know, how these things were all interrelated, but we can get to that later. You just wanted to know about my diagnosis. So I went back to another sleep specialist to get reevaluated, figure out where we were at this point. And my diagnosis from 6 years prior to when the VA had originally flagged me had gone from 35 in the severe category to 55, literally off the charts. And so the doctor that I'd seen at the moment, he was like, I don't even want to let you walk out of this office because I don't think you're going to make it. I don't think that you can make one more night through the many heart attacks that you're having right now. And I was like, well, you know, I guess I've made it this far. We'll see what happens.
Yeah.
So that's kind of how I got diagnosed with it.
Wow. So I see a common theme here. You've both seen many doctors, right? And trying to understand what was really happening. How has this impacted your family? And both of you have children. So how has that impacted your children and your family? Karen, you want to go first? Oh, you're on mute, Karen.
That's the worst. So I would say what impacted my family the most was watching me, you know, going around to try and figure out what was going on. And then, you know, after diagnosis, that was when, you know, after the memory impairment started to become even worse, as I was, you know, going to seek treatment, because the treatment that I was first seeking wasn't actually giving me subjective benefit. I think it really terrified my children because I eventually got diagnosed with a mild cognitive impairment. And so, you know, what was kind of simple word finding issues started to turn into everything else. So I think watching their parent like kind of drift off into not recognizing even people sometimes, at least not them. I remember them, but new people. I think it was a little terrifying for them to watch. And I know they're super happy that now I'm able to work and be fully functional. But there was a time, a couple periods of time where I had to be on work disability. And I think they were just worried about like what's going to happen next. So many things going on and so many things to worry about. And also like be, you know, thinking one day they're going to be my age and that they're going to have these issues too, potentially. And also just worried about the future, what's to be, who's going to be around to support them, because my children are all adults now, and I have one in there that's 30, and I have 3 kids, 25 to 30, and so they all have been around as adults to kind of watch me finally find out what was going on. But most of their childhood, I remember my daughter, when she was young, she mentioned that she noticed that I would fall asleep instantly when she was little, and she never understood why. Of course, they all noticed that I did all kinds of strange noises, made noises, gasping, choking, snoring, all of those things. They all knew that I did that. But her specifically, because she was the first, and it would just be me and her. She noticed that I could be like awake one second and completely out the next, and that kind of scared her as an adult to know that was actually something.
Wow. Jasmine, you have younger children, right? And how has that impacted?
Yes. My youngest is 7, and luckily my boys, the younger 2, they were young enough when I was not being treated that they weren't really cognizant of what was really going on. However, my oldest, she's sat down with me a couple times and said, Mom, I thought that I was never going to see you again. I thought you were on your way out. And she would come into the room on multiple occasions where I would be sleeping or attempting to sleep, you know, and again, like Karen said, making the noises, snoring, just ridiculous, you know, the walls on the house are falling down because of my snoring. And they all just made fun of me. They thought it was normal. They thought this was just the way Mom is. But again, I would be asleep all the time, and they couldn't figure out why I couldn't function. And I mean, I would get up, do as many things as I possibly could before I would be completely zapped out, drained, absolutely drained. And I would do maybe 5 minutes of standing, And then I would be so exhausted that I would have to go lay down, and nobody could figure out why I was so tired all the time. And my spouse at the time was really frustrated, couldn't figure out what was going on. He was just like, why can't you, you know, da, 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 da. And I was like, I don't know, I'm so tired. I can't figure out why I'm so tired. And I think for them, it was scary to not know. It was scary to sit there and watch your mom just not be able to function, not be able to think straight, not be able to remember anything. And I'm telling you, your kids will take advantage of that. My daughter would be like, you said I could go to the movie on Friday night. And I'm like, what? What do you mean? When did I say that? Okay, well, yeah. But I mean, now, and I still catch them. They'll try and pull one over on me, you know, and I'm like, you know what? That was broken mommy brain. Mommy's brain is working now.
Yeah. But your kids do understand. You've talked to them about sleep apnea, and they do understand.
They do.
Your
Yeah, I've had my daughter checked, and she does have it. My youngest, he's not old enough now. The technology's not there yet to support the younger kids to find out whether or not they've got, you know, the anatomy like Karen or like me. Mine is PTSD related. I have military PTSD, and I've now uncovered that I have CPTSD as well. So my sleep apnea developed in my childhood as well. But like Karen, it took my entire life to figure it out, because it's such a creepy, crawly illness, and it will just take over before you even understand what's going on, because people aren't aware of what to look for.
Jasmine, can you explain what CPTSD is?
Because it's childhood related PTSD.
Or childhood related PTSD. And you were never screened for PTSD before going into the military, or you think
I got PTSD through military trauma.
Through military trauma.
But through my research, I uncovered that my trauma came from way before that, through my childhood. And but when I got my military trauma, that just exacerbated the entire thing. And so, I mean, and they're all overlapping, as you know. You know, so I was in a state of where I could kind of maintain. My body had already kind of tried to correct itself by deviating my septum, opening up my airway. But then you add the military trauma to it, and it was just a given from there. You know, you're going downhill, sister. And so that was, you know, where it went.
Wow. And I think I think there definitely needs to be more awareness there too, among the women in the military, even veterans. About this.
And I'm a huge advocate of that, for sure. And not just women. I mean, anyone. The VA has linked PTSD so tightly with sleep apnea that if you have either of them, they automatically screen you for the next one.
Wow. Okay. Well, that's good to hear. So let's move a bit into treatment. Karen, you want to talk about your treatment journey? Because yours is very unique and different than sort of the mainstream, but tell us how you went about seeking treatment for sleep apnea.
Okay. Let's see. I started with CPAP and tried a lot of different masks. And because I'm a mouth breather and have been since forever, I don't remember ever. I couldn't really breathe through my nose very well. I had nasal turbinate reduction so that I could breathe through my nose, and that worked pretty well. But as far as being able to tolerate CPAP, I ended up choking. And when I would do any type of titration study to see what was going on, they would say you mostly choke, and you're swallowing air, aerophagia, I believe it is. So I'm swallowing air instead of breathing air. So then I would be very uncomfortable in the morning. And also, one of the things that I noticed was there's a happy face on the machine, and then there's the app, and the happy face was always there because I was always trying to be compliant due to the fact that I saw that guy get his machine taken away. So I really wanted to be compliant. And so for the year that I was on CPAP, I would get a happy face every morning, and I did not match the face on the machine.
That's very interesting you say that. Yeah, because a lot of people may not realize that. That just because you're being compliant, but not necessarily, you know, the treatment's working for you. And
then my Epworth sleepiness scale was around 16. And I think it would have been higher if I would allow anyone to drive me. I was always insisting on driving, which is terrifying because I
Yeah.
would get lost pretty frequently. And I really was having trouble with, I think Jasmine mentioned, hearing and vision. I noticed in the morning when I would wake up after having really bad sleep apnea that whether or not I use CPAP, because I would end up ripping that mask off in the middle of the night and waking up. I've been having apnea for probably the second half of the night, that I would have problems with tunnel vision and a little bit of, it felt like hearing loss in the morning. And then I don't know if that was what that was due to. I would assume that I'm just not breathing enough. And my apnea, my AHI or apnea hypopnea index was 20.6. And I know that we were not going to talk about our spec, but I would stop breathing up to 74 seconds at a time. So me with a CPAP and me versus, not with a CPAP, pretty big difference. But also the 45 years I was sick with sleep apnea, untreated, undiagnosed, that still, it takes a long time to undo that damage. And I don't know if any of, some of it will never change. Some of it is just the way I am. And because my airway was like breathing through, it's like breathing through a straw. CPAP also, that was another challenge. And then with BiPAP, which I tried for another year, that was the solution for the choking and swallowing air because of just the constant high pressure where you have the bi-level pressure. And that helped a bit, but still did not match the happy face that I was supposed to be achieving that I saw. And I would wake up not feeling better. I would wake up feeling worse. And I did try, I did cognitive behavior therapy for insomnia and nightmares from the mask. I used to call it the face monster, but I was using a full face mask.
Right.
And it really did terrify me. I didn't know I had claustrophobia, but I quickly figured out that I did. And so then I went on to, I found out about Inspire, and I got the Inspire implant in 2018 in July, but I actually was medically cleared the year before. And it took a year of battle, I guess, to get it covered. I had 2 different insurance companies, went through 2 independent medical reviews, went through a lot of hoops to get it, because at the time when I got the implant, there were about 3,000 patients. So the insurance companies weren't yet really approving it. It was a case-by-case basis. So I did get it approved, both medically and by the insurance company after doing all of the criteria that you have to hit to be a candidate, because not everybody is a candidate. And since I've gotten Inspire, my life drastically changed. I remember after I got it activated, that first night of sleep after activation was the best night of sleep I had, I think, ever. And I felt like better in the morning. And ever since then, it's been almost 6 years, and only I think 2 nights where I haven't used it, because one time I forgot it, my remote control, and then one time I was sitting in an emergency room with a family member in a chair overnight, and I remember I went to sleep in the chair. That was a really bad night of sleep. But I like to think of Inspire as it does for me what I can't do for myself. It moves my tongue out of my airway every time I inhale, and I can't do that on my own at all. And as I'm getting older, another thing that I noticed that's worked for me is that, there are other anatomy altering procedures that you can get done to treat sleep apnea or obstructive sleep apnea. But unlike those procedures where they're one and done and your best day is the day you have the procedure, this one is a dynamic therapy, and it is a therapy, not just a surgery. And so there are settings and they can be reset. And I've had my settings reset several times in the last over like 5.5 years, where, went from my AHI was climbing, and they were able to reset the device at my visit and made it beautiful, like as if it was the first day again. And right back to an AHI of 4, which is where I currently am, and then where I have been for most of the last over 5.5 years.
So more importantly, even in spite of the AHI, you've just been feeling great. You've
I
really
felt,
taken to this therapy
yeah, because I
really
went
well.
from being on disability from work most of the time, and then being able to work just enough hours to keep insurance so I could get my procedure,
Yeah.
to now I'm able to work and function and do things I wasn't able to do. I'm managing a store and have human beings that I'm responsible for,
Mm-hmm.
and making sure that they're okay, that they get their needs met, and then I keep
Mm-hmm.
on top of their stuff. And I couldn't even manage mine because I was spending a lot of my time just in bed and only going to doctor's appointments. I would never have been able to manage any of this. So yeah, it's
That's
definitely
amazing.
yeah.
That's amazing. Thanks for that, Karen. Jasmine, how about you? How was
I'm
your
currently on the
treatment experience?
BiPAP.
Mm-hmm.
I did try the CPAP, but because of the claustrophobia, I couldn't handle it. And I did find out that the um, forgive me, the claustrophobia is a result of the PTSD that is caused by sleep apnea, and it can flip either way. And I did find that out because when the VA put me on the BiPAP, because that was all I could handle, they switched my face component to the
Mm-hmm.
machine so that I just had the nasal cloud.
Yeah.
And I did find that the military developed that device specifically for veterans with PTSD because they couldn't handle having the full,
Yeah.
cover over their faces, which is very interesting to find. But I mean, I can handle having the nose cloud. I can handle having just the small face covering. But I mean, like Karen, I mean, I was ripping off that angry octopus every night, throwing it across the room, and I was just like, I can't handle this. It's, you know. And it took me probably 3-4 months of ripping it off and throwing it across the room before I could get a solid 4 hours of sleep under my belt. But after that first night of the 4 hours of sleep, I was like a new person, completely new person. And my spouse at the time was like, I don't even know who you are. And I mean, it had literally changed my brain function. And I wasn't the same person. I didn't think the same way that I was thinking in the past. I didn't rely on a safe space with everything I did. I mean, like Karen, you had to drive because that's what gave you
Yeah.
that feeling of control, because your body is so out of control that you have to be in control of everything that you can. And that's just a result of being in the fight or flight brain. But there are so many different components that fall into this, that people are just unaware of. And when your body is stuck in that fight or flight brain, you behave differently. You treat people differently, you respond differently, and you prepare for life in a different way. You can't just walk into a conference room and look at thousands of people and not panic and go hide in the corner, because your brain's just not working the way that it's supposed to. It can't go into that relaxed state. But my ability to go onto the BiPAP helped me to be able to be on the machine. I thought about the Inspire, but because I've had to have so many things removed from my body because of the sleep apnea, I'm like, if I don't have to get cut into ever again, I won't. I'll wear the creepy octopus. I don't care. But it took me a long time to get to the point where I could wear it all night long, probably 2 years straight of just struggling with just having it attached to my face. And that, I think, through most of the people that I've tried to educate on sleep apnea, that's a huge issue for most people, is I can't wear that machine. I cannot do it. And I say, I couldn't either. But when it comes to life or death, you go, is it worth it?
Right. No, that is very inspiring, and thank you for both for sharing, your journey with the treatment. What do you want women to take away from this today, who are struggling with even, diagnosis, or perhaps don't even know they have sleep apnea? So what's one message you would want to give women, from your own experiences?
I would say that if you feel like there might be a problem, or if someone has told you that you have some kind of issue going on with at night, that they hear some strange noises or lack of breathing or anything like that, or you have a bunch of symptoms you can't figure out where they're coming from. There's something that we do, everyone does every night, or at least we try. In order to like live, you've got to sleep, right? And there's a whole bunch of stuff that you don't know that you're doing at night, and that might be the thing that's happening. All of those hours go by that you maybe are not aware of, but maybe you feel really uncomfortable all day, and maybe you're going around to all these doctors, or maybe you just think that there's something going on. You've been told, oh, it's all in your head. Well, all of that stuff could be sleep apnea, and it would be better to find out than to not. And it's a pretty simple test considering all of the other symptoms that could happen, the catastrophic effects of untreated sleep apnea or undiagnosed sleep apnea. It's worth getting a sleep test to find out, or at least going to a sleep doctor or finding out about screening. Even taking an Epworth sleepiness scale would be worth it just to find out. And I think that, like, for women specifically, the 1 in 5 women having obstructive sleep apnea and 80% not knowing, that's pretty frightening. It's better to know than not know.
That's a good point. And ASAP, that's what we've been encouraging, as you both know, that we need to have women self-advocate, at least talk to their physicians, about their sleep health. Jasmine, for some reason, Karen got disconnected, but hopefully, she's back. Jasmine, what do you have, want women to take away from this today?
I couldn't agree with Karen more. And to be perfectly honest with you, the statistics are just astounding. So where I stand is everyone needs to be tested. Just everyone. Because the numbers are so high. And we just live in a society where we're all in such a constant state of stress that there's no reason that it shouldn't be a just built-in component to our annual reviews.
No, Karen's back. We lost you there for a second, Karen. No, that's a good point. But again, I think we need to have women talk about their sleep health with their doctors, at least bring it up, especially, as women are going through perimenopause and menopause, absolutely have those conversations. It's sometimes so easy for women to point out if their spouse or partner is snoring, but they forget to look at themselves the same way and ask those questions, right? Well, I want to thank you both today for sharing your journey and also inspiring other women. Thank you for being advocates in this space, and hopefully, we will definitely raise more of that awareness among women. So thank you today for this conversation.
Absolutely.
Thank you for having us on. Thank you.